Sato, please start.
Thank you, Chairman. Good morning, everyone. Today, the last day of the Congress, so I'm glad if you enjoy Hokkaido and Japan. So in my presentation today, I'd like to talk about this transrectal guidance of the ovaries reduce the operative time during bovine laparoscopic ovariectomy. I'd like to start. Ovariectomy in cows is performed for three main purposes. At first, it is a productivity. From this standing point, the ovariectomy is performed to increase feed efficiency and prevent fighting within the herd and obtain the ovary for in vitro fertilization. When ovum pickup from is difficult. So second purpose is for diseases, to extirpation the ovarian abscess and ovarian tumors, such as granulosa cell tumors. And third purpose is for research, such as research on the reproductive endocrinology and clinical study on hormone preparations. This slide shows a procedure of ovariectomy in cows. Ovariectomy can be performed with various procedures. In any given case, the procedure is chosen based on the purpose. For example, ovariectomy for increasing productivity is often chosen this procedure, colpotomy. This procedure uses a Kimberlin-Rapp spay instrument or Wheeler spay instrument. This instrument is inserted through the vaginal fornix and extirpation of the ovary after grappling. The incision site is not suture, thereby it can shorten the operative time. However, this procedure cannot be used for large ovarian abscess or tumors. While a frank incision is chosen for large ovarian abscess or tumors. However, this procedure, cow has a small uterus, perhaps due to being in the nulliparous or to the uterus being in the non-pregnant stage. The ovary cannot be ligated under the direct vision. With this procedure, bleeding from the ablation site is difficult to confirm. The second is the inguinal incision. In this procedure, the ovary can be operated under the direct vision, but this procedure limits the length of the incision site because restrained ligament position and the hind legs are held open. So this procedure cannot be used for large ovarian diseases. On the other hand, in a laparoscopic ovariectomy, the position of the ovary can be conformed with the laparoscope. So making it possible to conform the extirpation and bleeding reliably, even without the direct vision. In addition, a small wound minimizes the pain, consequently reducing the burden and enabling rapid recovery. However, when over-fatting or over-condition or insufficient fasting, it is impossible to secure sufficient intra-abdominal space. And therefore, the operating time is prolonged and increases the burden on the cow and the surgeon. So the aim of this study, how time required to complete the ovariectomy is affected when the typical laparoscopic ovariectomy is combined with transrectal guidance of ovaries. This shows a material method. We use 24 clinical healthy Holstein cows whose age and parity and body weight and BCS are seen in this slide. And we randomly divide these cows for two groups. Control groups perform the typical laparoscopic ovariectomy, while the guidance group combined with transrectal guidance by assistant. For both groups, we examine the time required for bilateral ovariectomy and performed the general status and blood test on this point. So next shows about the surgical procedure. After fasting for 24 hours before surgery, these cows restrained in the standing position, and we made the incision in the left flank. Anesthesia consists of lumbar epidural anesthesia and local anesthesia in the incision site. Surgery was performed by a surgeon and a laparoscope technician and the instrument assistant. And in guidance group, the ovary guided by the veterinary technician. A 30-degree laparoscope was inserted through port 1, and while the two pairs of the grasping forceps were inserted for port 2 and port 3. In control group, once the uterus was identified with the laparoscope, we follow along the uterus form, regrasping repeatedly until identifies the ovary. In the guidance group, the assistant grasps the ovary via transrectal approach and hold up the ovary to front of the laparoscope. In the both group, once identifies the ovary with confirmed with the laparoscope, ovarian body was and grasped by forceps, and injection cannula was inserted through the port 3, and anesthetic agent injected to the mesosalpinx and the mesoovarium. After anesthesia, mesoovarium was cauterized and ablated from its end. While confirming that there is no bleeding from the ablation site, we extirpation the ovary from the intra-abdominal space. The ovary of other side was done with the same procedure. In control group, out of consideration for a burden placed on the cow, the ovary removed via transrectal guidance if more than 90 minutes passed after skin incision. This shows the result about the time for ovariectomy. The time required to ovariectomy was about 63 minutes in control group versus 24 minutes in the guidance group. Thus, transrectal guidance significantly reduced the operating time. This slide shows about the blood test and general status. We cannot find any abnormalities in blood tests and the general status all over the point. In addition, no differences were observed between the groups. So in discussion, in rectal palpation is the most general examination technique in bovine clinical practice because the ovary can be held in mere second. Even in cow with a small intra-abdominal space, the ovary could be easily held up to front of the laparoscope. These findings demonstrate that the time for required to complete the ovariectomy can be greatly reduced by combining with transrectal guidance of ovaries. I'd like to sum up now. According to previous report, the laparoscopic ovariectomy takes about 120 to 150 minutes to complete. However, in this study, we are able to reduce the time about 24 minutes, combined with transrectal guidance of the ovary. Also, in the guidance group, the damage to the uterine serosa grasped by forceps was hardly observed. So, these results show that the transrectal guidance of the ovary reduce the time to complete the ovariectomy, laparoscopic ovariectomy in cows, and reduce physical damage to the uterus. Thereby, effectively contributing to animal welfare and reducing the burden on the animal and the surgeon. Thank you for your attention.